The more we learn about the opioid crisis in the United States, the more we see how far this issue stretches. You are here today to learn about the opioid crisis as it affects the workplace. We now know that the opioid crisis affects all types of professions. The opioid crisis has spread across the country, but rural communities with smaller workforces are hit especially hard. First, it is important to have a basic understanding about opioid misuse to make sense of how it affects the work environment. To learn more about what opioids are and the terms related to opioid use disorder, please visit our first video series. Substance use disorders like opioid use disorder were once considered personal, private problems that did not come into work. Substance misuse issues used to be swept under the rug and not discussed at work unless it affected the flow of business. But now, substance misuse, including opioid misuse, occurs at such high rates that it affects businesses of all sizes, from small family-owned companies to large corporations. Opioid misuse affects entire industries and communities in both rural and city settings. Construction, manufacturing, and trucking are some of the industries affected most. Many employers require employees to pass substance screenings in order to start or continue work. Yet, as employees struggle with workplace injuries, chronic pain, and/or stressful burnout, substance misuse risk increases. As opioid misuse worsens, increased absenteeism, lowered productivity, and increased risk for workplace injuries at work can follow. Opioids directly affect what happens in the brain, often making it difficult to be as responsive. Someone's ability to focus on their job may be affected while taking opioids, but they may feel they must take them to function. Employers and employees need to work together to maintain a safe work environment and change the way we handle opioid misuse at work. Employers can create policies to make sure employees can safely do their jobs, like expecting sobriety. Employers and employees can change attitudes in the workplace from judging and punishing someone struggling with opioid misuse to offering support and chances to connect to help. We want to shift attitudes, like the idea that opioid misuse only happens when someone is not responsible. The truth is, anyone is at risk of becoming dependent on opioids, even when taking according to healthcare provider guidance. Through this module, you have learned how opioid misuse can affect the workplace. Please click to the next video to learn about what opioid misuse can look like in coworkers.